Welcome to Boston Children's Answers. I'm your host, Dr. Jennifer Arnold. As a mom and a doctor, I'm passionate about helping kids stay healthy and happy. So join me as I chat with other Boston children's experts to find answers for you and your family. Hi everyone, and welcome back. Today we're going to talk about dental health and specifically dental anxiety. Before we get started, let's hear today's parent question.
Hi, I'm Joe. My son doesn't want to go to the dentist. I don't know what his older brothers said to him, but he just doesn't want to go. I've tried everything and nothing's working. Is there something I can do?
It may sound a little cliche, but going to the dentist can be scary for everyone, kids and adults. So today we're going to talk a little bit about how to manage that anxiety. With us today is our guest expert, Dr. Elaine Smyth. Dr. Elaine Smyth is a pediatric dentist at Boston Children's Hospital, Department of Dentistry. Hi, Dr. Smyth, and welcome.
I'm delighted to be here. Thank you for having me.
Oh, it's great I'm really excited about our conversation. Before we get started, one of the questions I always like to ask our guests is, how did you choose the specialty that you are in?
So when I was in dental school back home in Ireland, I had some really, really great mentors in the pediatric clinic. They're still great friends of mine to this day, and they were my pediatric faculty. They kind of inspired me to kind of follow this path, I suppose. So I worked in general practice for a couple of years after dental school, and I noticed that, seeing the kids was like the highlight of my day. No offense to the adults that I used to see. And then the more years that passed, the more I kind of realized, childhood is such a good time to get good habits in, to get prevention going. And if you can kind of encourage kids early and get them comfortable at the dentist early, then they may have like a lifelong happier experience at the dentist. So after about 5 years in practice, I went back to Trinity in Dublin to do my postgrad. So, yeah.
So you must have really fallen in love because you had to go back to school, right, to do more training for pediatrics specifically. And, clearly, I think the two of us are biased in this room, but pediatrics is the best way to go.
It is, yeah, for sure.
Well, so maybe before we get into dental anxiety specifically in kids, what is the importance of going to the dentist?
The earlier you go, the better. Okay. And you kind of get used to, the child gets used to having dental checkups regularly. It becomes just part of their normal life routine, much like going to the pediatrician. And then if you can go every 6 months, then that kind of keeps on top of things. It kind of keeps that link. The dentist is a familiar person, the dental office is a familiar environment. And then also the dentist can detect things that may come up, as early as possible. So we can kind of prevent things before they become an issue. So that's kind of
so
where we're
early.
From.
So really early. So as parents, we shouldn't feel silly trying to call our dentist.
No, absolutely not.
To bring our child in at 6 months of age.
No, absolutely not. It's a lot of the time, there's not that much to see, but it is still a good opportunity for, when we're new parents, we get so much information thrown at us, and it's hard to know what is the right thing to do and what's not the right thing to do, and especially teeth are such an unknown entity a lot of the time. So it's a good opportunity to kind of link in with a dentist who can say, this is normal, this what's normal, what's not normal, how to brush teeth, how to keep the mouth clean. Which
is so important for parents, especially because, again, I remember when I brought my two kids home, respectively from China and India, they didn't have probably the greatest of dental care, and we needed a lot of guidance in terms of how to help promote better dental care for them. And so establishing those tips and sort of what to do and what not to do as a parent is really key, I think.
Yeah, and it's hard because we do get bombarded with so much, and it's hard to know what the right thing is. So I think if you can have like a trusting relationship with a professional that you trust, and then that your children kind of learn to trust as well, I think that's all very positive and beneficial.
That's great. How often should you go based on the age of a child?
We usually recommend every 6 months or so. Some people may think every 6 months might be too much, but 6 months is a long time in the life of a baby, so it's still no harm to kind of get into that 6 monthly routine. And then that offers the opportunity to have fluoride varnish applied, kind of update cleaning habits and things like that, check in on diet and if there's anything kind of changing. And then as we grow older, that every 6 months is kind of very important.
And that makes sense too, because again, especially as they get older, you might think as adults, right? I think it's only every year it's necessary. I could be wrong. You could tell me.
I think it's Every 6 months still.
Every 6 months. Oh shucks. So I'm totally not compliant. So let me.
A lot of people are.
This is good. Let me work on that. So okay, for adults too. Let the record be stated. All of us need to learn. It's okay. See, I learn something every day.
I know, it's hard.
This is great. Okay. So kids and adults every 6 months helps to keep us
on top of things
and healthy and I imagine too, like, you know, my kids when they lost teeth, I was like, is this the right age? Is it too early? And you know, am I missing something? And when to think about, you know, whether or not I need to see an orthodontist, like all of those things, because our kids' teeth are constantly changing, I guess. Constantly. Is how I feel.
Absolutely, And one common thing that comes in, especially when it's their first child, parents can come in and they'll say, like around when the child is around 6, they'll say, oh, like, is this normal? And it would be like where you've got like a double line of teeth at the front, and that's completely normal. That's how teeth develop. Like the permanent teeth develop behind the baby teeth. But again, like we don't get a handbook when we become parents.
No,
I wish we did.
No.
But you know, that's not one of the things that when it's your first child, it can be quite alarming. So it's normal, and we get the opportunity to provide that reassurance when we see the parents very frequently with their kids.
Okay, so now that we've established that clearly I'm not going to the dentist as frequently as I should, but what happens if we don't take our kids to the dentist every 6 months or regularly for checkups? What could happen?
Yeah, if there's like a long gap between, you know, when they go, that allows things like cavities to form. But even on a very basic level, you know, you can have more plaque buildup. When plaque hardens, it becomes tartar. That can be very difficult to clean off the teeth, and you're not going to be able to clean it at home. So that means the cleaning that has to be done at the dentist is a bit more involved.
Which is not fun.
It's not fun. No, it's like the scraping, which nobody really likes. And when I go to the dentist, I don't particularly enjoy that either. So it's nice to not have to do that quite so often if we can avoid it. And then also, if you've got lots of plaque on your teeth, you're going to be more likely to get gum disease. And then cavities that everybody knows about. A lot of people don't know if we see cavities early that we can actually prevent them from getting bigger. Or we can we can reverse them or prevent them from getting bigger once they're in the enamel. So if we don't detect them early, we can't offer that specific advice. If you're regularly keeping up with your checkups, your pediatric dentist will be able to see your child's mouth develop and be able to monitor how the teeth are sitting. And if it looks like they have a lot of crowding, or if some teeth are missing, like not coming in the correct sequence, or if they've got a very big overjet or overbite or something like that, then if it's something that needs orthodontic intervention at an earlier stage, then they can provide the appropriate advice and referral. So some things are kind of easier to treat earlier than others, and then equally, if it's something that you know is going to come down the tracks, it's kind of nice to be prepared.
Yep.
So I think, you know, from that point of view, then it's really good to keep up regular contact with your dentist.
From what I'm hearing from you, especially in kids, because everything is still developing and changing, and you know they're going to lose their baby teeth and get the new teeth, and ensuring that all that happens the way it should, in addition to preventing cavities and you know and tartar and everything. It just makes sense to go earlier to help from a prevention perspective, and from just a treatment option perspective.
Exactly. Yeah. And then like there's also the opportunity for lots of anticipatory guidance, you know, because healthy diet that's healthy for teeth is also healthy for your whole body, you know. And then in school-aged kids who are doing lots of sports, we can give a lot of advice about trauma management or trauma prevention with mouth guards, and then if something like that happens, then we can manage it. And again, it's not an emergency, so it's, you know, all a bit more positive. That's the aim of pediatric dentistry, is to try and make things more positive, so we've got happier adult dental patients in the long run.
Exactly. So in order to get those benefits, though, do parents need to be seeking a pediatric dentist, or how do they know like what type of dentist to seek for their child?
Yeah, I mean, a pediatric dentist is specially trained to look after children, so they're going to be those that are most familiar with pediatric issues, monitoring the growth and development of a child. But in dental school, you do still receive some training in pediatric dentistry. So if you have a family dentist who's a very good dentist, and your family is comfortable with them and you trust them and they're happy to see children, then you can bring them there as well. Word of mouth is a good way of finding a provider that's suitable for you and your family.
The other thing that I imagine is always helpful if you're unsure about how to find a pediatric dentist, or whether or not to seek a pediatric dentist, is to talk to your pediatrician.
Yeah, absolutely. Our pediatricians are like a wealth of knowledge. You know I ask my pediatrician lots of silly to me questions that they probably think they get all the time, so it's probably fine. But absolutely, they are really, really great allies in the child oral health space. So for sure.
Perfect. So if you're unsure, talk to your pediatrician.
Absolutely. Yeah.
So let's circle back to our parent question that Joe had about his youngest being afraid to go to the dentist. I'm just curious, what are some of the reasons that you hear about from either parents or kids themselves about why they're anxious to go to the dentist?
Yeah, there are so many different things that we hear. It can even be something so simple as, I saw something on TV, or, the parent is a little bit anxious and they're trying their best not to transfer it onto their child, but the child kind of senses, like our kids know when we're anxious. So child kind of senses a bit of anxiety, so they're a bit apprehensive coming in. Our kids get so much information from so many different places these days. Kids talking together at school, and then everybody always tells their horror stories. They don't tell their happy stories. And then a lot of it is, a fear of the unknown. Like, I find any new scenario is kind of hard to go into as an adult. As a child, it's even harder. There's weird smells, there's weird noises, there's all these people around. There could be multiple kids having treatment at once, and somebody might be having a hard time, so they can hear them. And there's a lot of different variables. And then if they've had a previous negative experience, that's a really big kind of thing that can kind of predict anxiety in the dental setting. So that's why the better that you kind of have the routine visits down, so that they're not always coming for an emergency, so that it might not be a negative experience.
So it's important to go early and go when it's just a regular checkup.
Yes. Yeah.
So that you can establish that sort of comfort.
Rapport. Yeah.
In rapport.
Yeah.
Yeah.
A lot of children are afraid of needles and shots and things like that. So a lot of kids, even when they're coming for their checkups, they'll be like, am I going to get a shot today? Are you going to pull a tooth? And it takes a lot of time to reassure them and be like, no, we're not doing that today. That's not the plan. Any of that. So there's a lot of it's kind of like a multitude of different things, exactly. Can all lead to being anxious in the setting.
Well, and I'm just going to, again, sort of come out here and just share my the things that I think I've not done well as a parent is I am pretty sure that in trying to coerce my children to brush their teeth, I might have shown them pictures of horribly, decayed teeth and saying, you're going to have to go to the dentist and you might have to get shots to fix this. And look at this. This is why you brush your teeth now.
Well, I mean, I don't think you're alone in that. I think that's a very normal thing to do, because we also show that as educational. This is what happens when you don't brush your teeth, and we just show the big cavities. It's kind of normal.
Okay, good.
It's a cause and effect thing. I think that's kind of normal.
Okay, good. Because then I think my children might be they're like, I don't want to go to the dentist though. I think I had the wrong reaction, so maybe I included the shot part too much.
maybe I do often kind of say to parents, look, when they're preparing their child for an appointment, maybe don't say shot, don't say needle, don't say any of those words. It's like an elephant in the room, and if they're not thinking about that and you introduce it, then they're like, oh no, I didn't even think that was going to be a thing.
Yep. Well, we do the same in pediatrics, right? For your general pediatric appointment, we tell them don't talk about getting a shot.
Yeah, exactly.
Because, yes, we all need to get our shots, but you don't want to make it the focus.
Exactly. Because it is only a small part of what has to be done. Yes. And we can manage a lot of the anxiety around it, pretty well.
Okay, parents, try not to talk about the shots. Now that we've talked about sort of some of the fears that patients have and that kids can have, is there any difference for kids that have going to the dentist for the first time versus those that have established a long-term relationship with their dentist? Do you see a difference in anxiety level?
I think it depends. I think certainly for a lot of kids, if they've been going very, very regularly and it's become a very predictable environment for them, I definitely think those kids tend to be less anxious and apprehensive about the appointment. There are kids who have had lots and lots and lots of dental work done, who are super anxious because they've had those experiences. But equally, there are lots of kids who have had lots of dental work done and it's all been very nicely managed and they've gotten on well and they have a good rapport with their dentist and they've been fine. Like anything in life, there's a lot of different factors that can influence it. So if they have any underlying anxiety anyway, in general, any generalized anxiety, that's going to make them more anxious. If they've had a lot of emergency dental treatment, that will make them a little bit more apprehensive probably. And then things even kids who've had a lot of medical interventions can be a little bit more apprehensive in the dental setting. And it's just that they've been through so much in their life to date. They've had so many things happen to them and have needed so many things to be done that this is one more thing that can just be too much, Those kids, I think, are often kind of more anxious than others.
Understandably.
Yeah,
so,
absolutely.
Because they've been through so much. And
exactly.
Even though this may not just be a routine dental check for them, it's one more.
It's one more medical environment that they have to visit, So, yeah, it very much depends on the child, and temperament kind of plays into it as well. But I think for the most part, kids that are more used to it tend to be a little bit more relaxed than kids who are not.
So I imagine as a pediatric dentist, you have so many tools and skills in your sort of toolbox to helping any child who has this fear and anxiety. So can you share a little bit about some of the things that, you or pediatric dentists can kind of do to help decrease some of that anxiety and fear?
I think pediatric dentists are very good at getting to know our patients. I will spend a lot of time talking about favorite colors. Pets tend to be a good thing to talk about. School, again, kids like talking about like what grade they're in, that sort of thing. Sports, so I'll always kind of try and find something to connect with them about. And I'll usually make a note of it so I know the next time I'm like, oh, that is so-and-so and her favorite color is pink and she likes unicorns. So we'll talk about unicorns.
Oh.
So that kind of ties into the technique of distraction, because distraction is very helpful. Counting is also very helpful. I use counting a lot in my practice. Counting down specifically, because that makes things very predictable. So that, again, that's trying to make things more predictable for a child, make them more comfortable, make them feel like they have a little bit more control of the situation. So I say, okay, do you want me to count down from 10 or 20? Okay. They'll usually choose 10. So I'll just do 10 slowly. But it still means once they know, once I get to one, I'll stop and take a break, and then at least they get a breather from the noise, they get a breather from the water, they kind of can just kind of recalibrate a little bit and then go, okay, I can do another 10, which is much easier than if someone is just like working away and you're just sitting there being like, is this ever going to be over?
And not having any sense of the end.
Exactly.
Yeah.
We can do a lot of other things to help them feel more comfortable and predictable, make it more predictable for them. So another technique is tell, show, do, where you tell them what you're going to do, and then you show them, give them a little demonstration, and then you do it. It's really helpful, especially if you have a child who comes in with a stuffy, and they're really nervous about opening their mouth and letting you have a look in. So I'll often say, let's check Teddy's teeth. So I'll have my mirror and say, now so we'll check Teddy's teeth, we'll count them, and we'll look in my mirror. And then, you look in the mirror and you count Teddy's teeth, and the child helps with counting Teddy's teeth.
Okay, good.
And then we say, okay, now it's your turn. And then they're usually a lot more open to it after you've done some sort of an interaction like that. So I use mirrors a lot, even a face mirror. I'll have them I'll say, you look in the mirror and you count your teeth. And then I'll kind of look with them, and then I say, okay, I've got my tiny little mirror, it does the same thing. And then, they watch me do it. So it makes it a bit more predictable and a little bit more comfortable. And takes away that unknown, because we're very much when you're working in someone's mouth, you're very much in their personal space. So I feel that if we can kind of take away some of the unknown, that makes them a bit more comfortable. And then even the environment itself is very important, the dental, the clinic environment. So a lot of pediatric offices will work very hard to make sure that they have child-friendly pictures on the walls, make sure things are bright and welcoming. There's a lot of research into what children feel comfortable with in terms of dress, in terms of decor, things like that. So we are very mindful about that. We do get a lot of training in that in our residency programs, to kind of help us plan for that sort of thing. And we just got our new clinic, which is very spectacular and very, very much follows the principles of what a child-friendly dental environment is like. So, our patients are really happy.
That's so
over there
cool.
now. Yeah, it's amazing.
Well, you're right. I mean, you go to a pediatric dentist and it's just, it feels like a happy place a lot of times. I mean, and sometimes there's things to distract them.
Exactly.
Videos and things.
Yeah.
And lots of pictures, like you said, and just the fact that you use the evidence of what, we know helps kids feel more comfortable.
Exactly.
And designing that space with that in mind is huge.
Exactly. Because it's not just plucked out of the air, it is actually grounded in evidence, which is the basis of what we do. So
it's great. When I think about my own kids, there's always a concern in the back of my mind. Maybe that's just because I'm a clinician at heart. So of safety related to sedation. So what about sedation for kids? When do they typically need sedation when they're at the dentist? And how do pediatric dentists help to improve safety or ensure safety?
Sedation is definitely a good tool in our toolbox. There's different levels of sedations, and we're very strict about how we do things. Right. Every child is so different and metabolism is so different.
Yeah, so you have to be prepared.
Exactly, and it has to be safe. It has to be with trained professionals. It's something that we don't take lightly, but we're very lucky to be able to offer.
And I think, like you said, like maybe having a conversation with your dentist about, what are their safeguards? Do they have the equipment needed to help rescue? And is everyone trained and how to...
That is definitely, as a parent, that is absolutely what I would ask about. So always make sure that the safeguards are in place. The state that we're in, Massachusetts, is very, very strict.
It's very regulated, but not all states are like that.
No, exactly. So it's still important to always ask those questions, no matter where you are.
Well, thank you. That's really important advice.
Yeah, for sure.
So I think as we've talked about a lot, what are things that, we as parents can do to help our kids to decrease their anxiety for going to the dentist?
Parents can really help by how they speak about it at home.
Okay.
And, when we're talking about preparing kids for the dentist, we will often tell parents, just be very, either be like mildly positive or just be neutral about it. Just be very factual and say, yes, we're going to the dentist. They're going to count your teeth. They might take some x-rays. They'll clean your teeth. That's it. I think so
don't be like, oh no, you got to go to the dentist.
Yeah, I think less is more for sure, because sometimes when we go over the top and we really labor the point, like, oh wow, we're going to the dentist, this is so exciting, and kids get a bit suspicious. They're like, why is mom so excited about this? This is weird.
Yeah.
So I think
they're smart.
Kids are very smart. We underestimate kids all the time. There's no need to spring it on them as a surprise. I would say prepare for it, like, oh, we're going to the dentist on Wednesday or whatever. And some of the stories they do hear can be kind of scary for them, and they're worried that the dentist is going to cause them some pain. So obviously that's going to be something they're going to be nervous about as well. So that's a big thing that we kind of come up against.
Yeah.
They come in the door and they go, oh, is it going to hurt?
You're right. Kids talk to each other.
Exactly.
And siblings and, anyone.
Yeah. Anyone. Absolutely. The dentist does not do well in horror movies. If your child asks you something and you're not really sure, the best thing to do is just say, you know what, let's ask the dentist when we get there, because I'm not sure what they're going to do, but let's ask them when, and they'll tell you, because we have ways of explaining things. We say sleepy jelly for the anesthetic gel, we say sleepy juice for the actual injection. So it's a lot friendlier than saying we're going to put some gel on your gum and then we're going to give you a shot. We don't really.
So don't feel like you have to know the answers as
exactly, a parent. Exactly. We are here to help. We don't know all of the things all of the time as parents. We don't know all of the things all the time as dentists. So we try and work together and form a partnership where we are here to support a positive experience for your child.
That's really key.
Yeah.
Well, and along those lines, I think you alluded to it before, but pediatric dentists go through a significant amount of training.
Yes.
To help to help with, how to talk to kids and how to provide that safe environment and how to work with kids in the dental chair. So do all dentists go through that training, or is this something specific to pediatrics?
To become a pediatric dentist, you do 4 years of college, and then in the US you do 4 years of dental school, and then you do a minimum of 2 years of residency. And your residency is focused on pediatric dentistry. If somebody is a pediatric dentist, they have that additional training.
Okay.
General dentists are really, really good at lots and lots of different things, but pediatric dentists would have that focus in taking care of children and have done that extra training in sedation and behavior guidance and how to interact with children and parents, more so than a general dentist would have done.
Yeah, because kids are not little adults, and their dental needs, in addition to their emotional needs of coming to the dentist, are very specific.
Very, very specific. Yeah. It's not the same as just having a smaller form of an adult. It's not the same thing at all, because developmentally it's different. The level of understanding is different, even between a 2-year-old to a 4-year-old to a 6-year-old, all very different, so even within childhood, it's not a one-size-fits-all approach. So especially when we're seeing children every 6 months, every however long, a lot can change in that time. So it is important for us to be mindful of that. So we have to do a lot of training in the psychology, the development, all those kinds of things.
I'm just going to tell you a little bit of my personal experience. So, when we brought our kids home again, I was really nervous about their dental health, because I looked, and Zoe was 2 and she didn't have many teeth in, really. So I knew she was already a little bit behind the failure to thrive issues, and I know that can affect teeth. So we sought out specifically a pediatric dentist because I thought they might be more equipped to supporting not only knowing how to care for my child's teeth, but also like having some of the skills needed to help, help them to have less anxiety, because I knew that there was a language barrier and they were nervous. They hadn't probably ever been to the dentist. So I was just curious, if you had any thoughts or recommendations, particularly for parents who have kids who may have more complex medical needs or maybe even a neurodiversity, like if there are certain things that we should be looking for in our dentists.
Kids who have any type of additional need, and that ranges from like a kid who's really anxious at the dentist all the way to like the most medically complex kids that we see here at BCH. And I think for those cases, definitely a pediatric dentist is really in their best interest, because they have, like, we do lots of additional training. Like you mentioned earlier, we go back to school, we do extra years of training. We do specific like training in like child behavior and how to kind of work with child psychology to help children feel more comfortable, little tricks like making things more predictable.
Is there anything that, you'd approach differently in those populations?
We always have in the front of our mind that every person is an individual. That's where I start. Like, I'm very conscious of that. I meet families where they're at, I meet children where they're at to the best of my ability, and try and bear in mind other challenges that they have. For sure, like kids that are, people who are on the autism spectrum or have any other sensory differences or any neurodiversities, absolutely the dental environment can be very challenging, because it is a very sensory environment. There's a lot of things that, for a neurotypical person, it's no big deal. It's just lights, it's just a noise. It's like, not a big deal. But for a person with, a sensitivity to sounds, like a very mild hiss from a suction can be so irritating. So I try to be very conscious of things like that. And I know like all of my colleagues are the same. So we're very conscious to ask families, what works for your child, what doesn't work for your child, because that's also super important to know. Our team at the Department of Dentistry here at Boston Children's Hospital, we are a big children's hospital. So a significant proportion of our population do have some degree of medical complexity. So we see a lot of children with, generalized anxiety, we see autism spectrum disorder, Down syndrome. We see a lot of children with cancer, with heart disease. So, we have a lot of children who have a lot going on in their lives. These are the kids that have had lots and lots and lots of interventions over their lives, and we're just like one more person telling them that they need to have something done or they need to do something. Those are the kids that, brushing their teeth twice a day is like, really? I have to take like this many meds and I have to do this XYZ, and I'm, and then they're like, and this person is telling me I have to brush my teeth. So we do have to bear all that in mind as well, that teeth are really important, but they can be really, really challenging for families to manage as well, because they've got so much else on their plate.
Yeah, their plate is already full.
Very full. Yeah, overflowing in many cases.
You take each individual where they're at and you try to meet their individual needs. And I think that's, to me, what makes it so valuable to see a pediatric dentist.
Yeah, I think that's like the number one thing. It's so important. We are like experts in teeth and all things to do with the oral cavity. But at the end of the day, families are the experts in their children. And I think it's really important to validate families for that. I think, especially families with these children who have medical complexities, we work in partnership with our parents. In our department, for instance, we always have these like self-management goals at the end of every recall visit. We'll say, okay, we recommend that, you brush 2 times a day. Start using a fluoride toothpaste. We'd really recommend that to prevent cavities. And ideally get rid of juice, or if they're, if a 2-year-old who's still breastfeeding overnight, you'd say maybe try not to breastfeed overnight, or try and like wipe the teeth after feeding. We try and offer it as like a menu of things that we can work on. And some families are like, you know what, I really just can't do that right now, so we kind of try and choose like 1 or 2 things that would say, okay, this is something that's achievable. Yeah. This is something that is a goal that we can work on together and try this at home and see how it goes. And if they've managed to kind of get into the swing of the brushing and the flossing and whatever you've decided to work on, then we can move on to new goals, So I think that kind of an approach is really, really helpful for families. And I think it's really important that we build like an alliance. A lot of people just kind of look at the dentist, like the dentist going to tell me I have cavities and da-da-da. It's a shame, but I see where it's come from. So I think it would be nice if we could like turn that around. And I know that's what pediatric dentists try to do in general. That's how we operate.
Yeah. Well, you're kind of like, you're meant to be like, you're functioning, it sounds like to me, like you're like your coach, right?
Yeah, that's what we want. You know, I remember reading something once that was like, dentists are one of the only professions that try really hard to go out of business. Because, or I'm not sure if I have that exactly correct, but it was something like that like we're always going on about like how to prevent cavities, but yet like people come to us have their cavities fixed. And I would love to just see my patients every 6 months for a chat and catch up on favorite colors and
see that their teeth are
favorite music.
perfect.
And yeah, that would be the ideal world. So, I mean, that's a dream. But, you know, until then, we can fix the things that need to be fixed, but work on building happy, healthy child dental patients that grow into happy adult dental patients.
I don't know why this came into my head right now, so you can take it for what it's worth, but all of a sudden I was just thinking, my kids actually initially were very nervous to go to the dentist, but then they started loving the dentist. And do you want to know why they loved going to the dentist?
Why did they love the dentist?
The treasure chest at the end.
I was like, I bet their dentist has a really good treasure chest.
Yes, they had a great treasure chest. And like all of a sudden I was like, oh, we're going to the dentist? Okay. Like,
what treasure will we get?
Yes.
Yeah.
So it's always...
My son is the same. He loves going to the dentist because he gets prizes.
Yep, exactly. So that's something probably pretty unique to pediatric dentists.
That's true, actually. That's true. We just bribe our patients.
Yes. Yeah. We all do it as parents.
Yeah, but it's important. I do think it's important. Like, they go through something hard. Even the most relaxed pediatric patient, it's not a natural environment for them. They're not in it every day, and they do so great, you know. And for the kids that find it hard and they still get through it, I think everybody deserves a treat at the end of it. So the treasure chest is highly important, I think. Yeah,
I agree.
Yeah. I love that story.
So, you know, overall, are there any tips for do's or don'ts that can help parents to promote good dental health?
Start early with good habits, as I probably have said about 10 times already.
Yes.
I really labour that point. But in all seriousness, you know, once our kids' teeth come into the mouth, that's when the important time starts. And then another really good tip that I learned in my postgrad training that I have used every single day since is advising parents to brush their kids' teeth while they're laying down, which a lot of people are very surprised about. But actually it's the easiest way to brush a toddler's teeth, because toddlers are very squirmy. So, you know, I know my little boy, if I tried to brush his teeth standing up, he'd be like, you know, running away from me.
Oh yeah.
Whereas if they're lying down, you know, it can be part of the normal bedtime routine. You know, we have our bath or our shower, we get into our jammies, and then he brings his toothbrush, we lay down, and then so you can get right in, have a good look around and see all the teeth and brush a lot easier. That way. So I
needed you like 5 years ago.
Oh, I don't know about
Good
that.
idea.
But yeah, I think that's really, really important. And then, you know, a good thing to remember is 2 minutes twice a day, brush your teeth. Make sure that you know, you're helping them to brush their teeth until they can tie their own shoelaces or colour in between the lines, whichever is, you know, the earliest. But usually the shoelaces is a good indicator of dexterity.
All right, that's good. That's a really helpful tip, and so important, because yes, my kids were moving targets for me to brush their teeth.
Mine definitely is a moving target, and some days it's easier than others, and I'm a pediatric dentist. The important thing is perseverance and getting in there.
Well, thank you so much, Dr. Smith. This has been
thank you for having
such
me.
A great conversation, so much fun, and we learned a lot. Now on to doctor's orders. This is the part of the show where we help prescribe an action that you can take today to help raise healthy kids. Oral health is important for your overall kids' health, and to start early. If your child seems to be having anxiety going to the dentist, it's always a good idea to talk to your child about it, and most importantly, talk to your dentist, give them a heads up so that they can be prepared with all of the skills that they have and the tactics in their toolbox to help make that experience for your child as low anxiety as possible. Thanks for listening to Boston Children's Answers, and a special thanks to Joe, our parent, and to Dr. Elaine Smyth, our pediatric dentist. If you'd like to hear more podcasts, tune in and subscribe to wherever you get your podcasts. Thank you so much for listening, and see you next time.